You said if we keep delivering cancer care the way we do now, we will lose. That's a stark warning.
Right now, in the next 2 decades, we will see a 50% cancer incidence in my part of the world, in Australia. I think there's a whole range of reasons. There's lifestyle reasons. There's the foods we eat. We're now facing what I call the global cancer burden. Change is difficult for human beings, and it's even more difficult for professionals who may well be wedded to something that worked really, really well 5 to 10 years ago that now needs to change.
What do you think can be done to get more people interested in pursuing a career in this?
No one knew what a radiation therapist was when I spoke to them in 1995 when I qualified. My mum and dad probably didn't know what a radiation therapist was. I don't think we've done a great job on promoting these amazing careers.
Mark, welcome to the show.
Thanks for the invitation, David. Great to be here with you.
We had a great conversation a few weeks ago, and something you said really stuck with me. And I just wanted to sort of start the conversation by asking you about that. You said, if we keep delivering cancer care the way we do now, we will lose. That's a stark warning. What's the reality? What are you seeing that led you to that conclusion?
Well, it is a stark warning, David, and designed to be so. We're now facing what I call the global cancer burden, which right now in the next 2 decades, we will see a 50% cancer incidence in my part of the world, in Australia, and it is worse in Asia and other parts of the world. So we are going to see more and more people diagnosed with cancer. We're going to see more and more people live longer with cancer. Right now, we don't have the workforce to deliver services to all of those people. We don't have the geographical locations to deliver services to all those people. And the cost of cancer care delivery continues to go up exponentially. So we need to rethink how we deliver cancer services in 2025 and beyond. We need to be more innovative than ever before. We need to embrace technology, and we have to be prepared to change. And that's why I say it. If we don't change, we will lose against what I call the global cancer burden.
What's driving this increased rate of cancer, do you think?
Well, I think there's a whole range of reasons. There's lifestyle reasons. There's the foods we eat. There's the certain lifestyles that prompt a cancer diagnosis. But also, we've become incredibly good at diagnosing cancer and finding it early, which is a great thing. But what that also means is cancer's really transformed into a chronic disease whereby we diagnose cancer patients really early, we treat their cancer, they live otherwise normal lives, but they might have multiple courses of treatment across their life. So that puts enormous burden onto our healthcare sector. People are obviously also living a lot longer, which is part of that chronic disease status. So we're facing multiple challenges at the same time.
And you mentioned there as well about being able to find the staff that we need, the people to help us fight this. Are we talking there about sort of doctors, nurses? Give us an insight into the people challenges that we're facing.
We're talking about all of them. So oncologists, highly trained, very, very well remunerated, and rightly so. So they're an expensive resource. We then have a whole range of allied health professionals, nurses, as you mentioned, pharmacists, radiation therapists, radiographers, medical physicists. So cancer care and the delivery of cancer care relies on a really multidisciplinary team. These are very, very highly skilled people, and as you would expect, very, very well trained with years and years of training. They don't grow on trees. We need to deliver more cancer services. We, quite frankly, right now don't have the people to do so. And that's why we must embrace technology. We must embrace automation. And it's not about replacing people. And I think that I want to be really, really clear on that point. It's about enhancing the people that we do have so that we can reach more people with life-saving care.
Mark, tell us about your path. What led you to where you are now?
Well, look, I'm a radiation therapist by training, so which meant that I planned and treated the radiotherapy for cancer patients, and I started my career in regional Victoria, which is an important part of my story because I grew up in regional Victoria and I could clearly see the inequities of care in that people from regional and country Australia often weren't able to access a treatment like radiotherapy because in those days in Australia it was only really delivered in capital cities. So I'm very, very proud to be from country Australia, and I wanted to make sure that services were available to people in country Australia. So I went off, I followed that career pathway. I was fortunate enough to work in North America and Europe as a radiation therapist. Came back with some ideas, a lot of ideas to Australia about how we could improve access to cancer care in Australia. And that's what ICON's been doing since our humble beginnings in Toowoomba in 2007.
And so you're a radiation professional. Like you say, you had the opportunity to go and work abroad. You come back to Australia, you've seen some ideas that you think could help. How did you then go about, 'cause I presume you didn't just then become the CEO of ICON. No. How did you as a sort of healthcare professional sort of take those ideas and ultimately move them through into the business world?
Well, I'd learned a lot from working both in Canada and the United Kingdom. I worked in the public healthcare sector in Canada and the private oncology sector in the United Kingdom. So I learnt a lot, and I came back to Australia with a lot of ideas and a lot of ambition. What happened was my three original business partners were commencing a radiation oncology facility in Toowoomba in regional Queensland. I applied for a job with them. To my great benefit, they chose this young guy. They will say very confident young man from country Victoria. They chose me and I chose them, and that partnership obviously evolved over time. We established our service in Toowoomba, where I joined as the chief radiation therapist to lead that service. We very quickly grew. We were awarded Australia's first public-private partnership for radiation oncology at the Cairns-based hospital in 2011. We're still there some 14 years later. And then we followed that up with a service at the Gold Coast University Hospital. We had a wonderful team of people, and we had built a model that was able to deliver radiation oncology, particularly in locations where previously it was thought you couldn't. We saw a great opportunity to bring more care to more people across Australia, and that's exactly what we did.
And this, I presume, is where the power of kind of entrepreneurship and that private part of the private and public partnerships that you talked about comes in.
Yeah, absolutely. I think we only specialise in cancer care. So we're not a hospital provider, and we're not going to be a hospital provider. We partner with our hospital partners who are really good at running hospitals. We're really good at delivering cancer care, and I think specialised services are certainly capabilities that hospital providers can partner with people like ICON around. So really we had this great track record of initially partnering with private hospitals, which then translated into partnering with public hospitals as well, which we've continued to do really over the last 2 decades across Australia, and now hopefully we'll be able to do that abroad as well. So in terms of the private entrepreneurial spirit, you're absolutely right. We are very, very good at what we do. We have great people, and we've had people who've been with us on this journey for a long time who are absolutely expert in what they do. When you've been doing things, there's an old saying, I think athletes and musicians talk about having 10,000 hours under their belt. We're the same. We've got a lot more than 10,000 hours under our belt. We're really, really good at what we do. So knowing what works and what doesn't has become a great skill for the team at ICON.
Something we talked about quite a bit previously, and you've mentioned already multiple times here, is perhaps the role of technology, the need to innovate and quickly. What's standing in the way of the innovation that's required in cancer care right now?
Look, I think it comes down to a couple of factors. Number one is resistance to change. So when you have been doing the same thing for many years, and certainly in your mind that it has been successful, it's very hard to change. Change is difficult for human beings, and it's even more difficult for professionals who may well be wedded to something that worked really, really well 5 to 10 years ago that now needs to change. And I think we've all been guilty of that in some way, shape or form. So I think there's a resistance to change. I think people are also naturally concerned and worried that what if the change doesn't work? And what if we actually go backwards? And I think that is a real fear for many, many people in the oncology industry. So we have to get over that. We have to show things that work, and we have to show a track record of experience. Now, certainly from my perspective, ICON has that track record of experience because we've been doing all the things I talk about now on the global stage. We've been doing them in Australia for some time. So it's about change. And it's also, however, about in the brave new world of AI and innovation and automation, there is, of course, also fear of the unknown. And I think that there are so many choices to be made that you really, really need to make very, very disciplined choices on what are the horses you're going to back in that AI and automation race, because it's very, very easy to back the wrong horse. There are so many choices of products. Do you go off the shelf? Do you develop something in-house? What do you need? We have a lot of processes in place and a lot of frameworks on how we choose what our strategic direction is in that space. And we put a lot of work and a lot of discipline into making those choices. So for me, it comes down to those two factors. It's around resistance to change, and then it's about making the smart choices on the tools you use that ensure success.
And I imagine with the resistance to change piece, and for most businesses, that's, hard enough. But when you're talking about people's lives, quite literally,
Indeed.
I guess that really does. And I'm sure there's plenty of stuff you can do within the business that is not going to, directly impact the healthcare a patient gets, sort of back-end processes and things like that. But I'm sure there are plenty of things you're looking at that do directly impact on patients. How do you kind of coach your team through that?
Yeah, it's a great question. I think, look, ultimately what you need to do for all healthcare providers is the patient must be at the centre of everything you do. So if there is something that looks like it might be a good idea, but that might compromise patient care, even unknowingly, then it's a non-starter. You just don't do it. There is an awful lot of testing, discipline, analysis of all tools before we would actually put anything out into the field. We also work really, really closely with our technology vendors on those things as well. So there is a lot of belts and braces on these projects and products, and a lot of hurdles to jump before you can take them through into patient care. But what I would say to anyone who's listening is you must have the patient at the centre of everything you do. That must guide all of your processes, all of your innovation, all of your approaches to technology. And for me, that is also about encouraging people to embrace technology, because if we've got cancer patients waiting a long time for care because we don't have the tools to shorten that wait time, that's a huge problem, and that needs to be addressed. So I think the embracing of innovation is really, we have to do it, and we have to do it now at pace, but we also have to do it in a really disciplined, measured way. Those two things are not always easy to combine, but that's what we must do.
What are some of the technologies or particular areas of innovation that you're most excited about and will be focusing on?
I'm absolutely passionate about the concept of individualised cancer care, which means that every single patient has a customised and individualised care path and course of treatment for what they require. Now, what we're seeing right now, particularly in the world of radiation oncology, which is a technology and innovation-led industry, is we're seeing the shortening of courses of radiotherapy. We're seeing more accuracy than ever before, which means we target the cancer and we miss everything else. And that's and that has been the premise of radiation therapy since time began. Hit the tumour, miss everything else. We're now doing that in a way that is minimising side effects. It's minimising trips to the treatment centre for patients, and it's delivering better patient outcomes. It's expensive technology. You have to invest in it. You're not always appropriately remunerated for that investment, and that's fine. We need to continue to push forward. But it's also about the training of your people. And I remember I said at the start, David, we don't have enough people. So we're also training people at the same time to continue moving forward with these innovative courses of treatment. So what we're seeing happen right now in radiation oncology, with the capacity to deliver more pinpoint treatments and more accurate than ever before, is really groundbreaking. And certainly we've been at the forefront of that, working with our technology vendors, and I think it's a great outcome for our patients.
What do you think can be done to get more people interested in pursuing a career in this?
Look, it's really interesting. Being a radiation therapist myself, no one knew what a radiation therapist was when I spoke to them in 1995 when I qualified. My family, my mum and dad probably didn't know what a radiation therapist was, but they'd certainly supported me and funded my journey through that course, which I'm forever thankful for. So I don't think we've done a great job on promoting these amazing careers. I think everyone understands the value and the great role our nurses play. What about our radiation therapists? What about medical physicists? What about pharmacists? What about oncologists? I think we need to promote these careers more, and we're certainly trying to do that. The reality is, and one of the reasons I chose radiation therapy was, here you have an occupation where you get to have tremendously meaningful interactions with cancer patients in their hour of need, and in radiotherapy that's every day for a course of treatment, which could be up to 6 weeks. You get to know these people really, really well. So there is a human side to this profession and to cancer care professions. But there's also, for people like me, who are fascinated by technology and innovation, there's also that side of it as well. So it's a marriage of two different worlds, the human aspect and the technical and innovation aspect. And I think that's incredibly exciting. The people we have now coming into, cancer-specific professions, these are the smartest people you could imagine, and they're looking for the combination of those two elements. They want to have that human aspect, but they also want to embrace technology and push the envelope on what's possible. That's incredibly exciting. We've got to do more to promote these professions.
Completely. And you hear all the time now about people lacking sort of meaning or purpose in their lives. I mean, I don't think it gets more meaningful and purposeful to do what you guys do, being able to come into work every day.
It doesn't. And that's one of my great motivational tools for the people at Icon. The reason I get out of bed every single morning is to help people. That's my motivation. And that's an easy mission to get behind. You think, and I say this to all of our people, it doesn't matter what role you play at Icon, you are making a meaningful impact on patients, their families, and their communities. That is work worth doing.
You're now operating across 60 plus centres worldwide. What's been key to achieving that level of scale without losing that sight of care quality and having the patient at the centre of everything you do?
Yeah, well, look, not only do we now have 60 cancer centres around the world, we also have our 70 plus managed hospital pharmacies in Australia, and now up to 6 chemotherapy compounding facilities, 4 in Australia, 1 in New Zealand, and now 1 in the United Kingdom. So we have grown significantly. One of the things that I'm very, very focused on is we're in those countries because we're Icon. And our partners want to work with Icon, which means we need to be Icon. If you just wanted to work with someone in Singapore, if you're a hospital provider, you could just choose someone who's a Singaporean healthcare provider. So there's a reason we're there. It's the same in the United Kingdom. So we're a proudly Australian company who we understand who Icon is and what Icon offers. And Icon's about delivering the best care we possibly can to people close to home, whilst also ensuring that we have a tremendous group of people who want to deliver that care. So by growing so rapidly and internationally, how do we go to other countries where there's different cultures and there's different approaches? We're still Icon, but we embrace the local customs and local healthcare. So we've navigated that very, very well. And that was certainly one thing as we continue to grow is how do we continue to be icon while being really respectful to our colleagues in Singapore, in Malaysia, now Indonesia, across China and also into the United Kingdom. So it's about having the fundamentals of who we are at the forefront of what we do. I talked about people getting behind our mission, which is the best care possible to as many people as possible, as close to home as possible. That's universal. That matters in every single country you go to. Putting the patient at the centre of everything we do. And unfortunately, as we talked about at the start, the global cancer burden is also universal. So despite the differences we may see in our international locations, the challenges are universal and the approach that ICON takes to them are the same. So I think that's been a key component of who we are. And I'm incredibly proud that our people in all of those countries are incredibly proud of what we have all built together at ICON, because we are a team and we built this together.
What have you learned about kind of taking your core culture, which to me sounds extremely sort of strong and well established? You, like as you say, you take that into a new country, let's say a new geography in this case. And what are some of the practical lessons you've learned about how you sort of implement that within that new culture?
Well, I think you have to continue to evolve, but you don't lose the things in my mind made us great. And I believe very, very strongly in authentic leadership. So from my personal perspective, what my people see is me. There's no smoke and mirrors. This is me, and the good, the bad, and the ugly. So you've got to be an authentic leader, and which means that my executive team, who work directly with me too, have to be authentic in their leadership. We've got to be open. We've got to be transparent. We've got to be prepared to communicate at all times, even if it's bad news. And that is something that I've learned along the journey, that I share bad news early and always completely and utterly bluntly, because people appreciate that and people, I think, respond to that. So I think you've got to be honest, you've got to be transparent, and you've got to be authentic. That means also that when things aren't necessarily going perfectly, and look, it's hard to go into new markets. It's hard if you acquire a business in a new market who have a culture that they've been really, really proud of and that they've built, and they have their own nuance, and you absorb that into the ICON culture. And I think you have to do that really, really respectfully. And I've always been a big believer that when you have another organisation join your organisation, that you can learn enormous amounts of each other, and it shouldn't be a one-sided relationship. And that's how I think you get alignment. So if I was to come back to those, I always say this, ICON, we are a very progressive, innovative organisation. We're built on some very old-fashioned values: authenticity, transparency, honesty, loyalty, relationships. Those things matter. And I would argue that in this world of maybe decreasing connection, they matter more than ever.
Yeah, and the personal touch as well, right? And how that impacts on the patients.
Yeah, absolutely. You've got to have a personal touch. And now we've grown from, 20 team members in Toowoomba to now almost 4,000 around the globe. I have endeavoured to not change my leadership approach at all, apart from being on a bigger scale and a bigger stage, and that means having a personal touch. And people often say, well, Mark, how can you manage that? Anyone across ICON, and I tell them this, you can contact me directly, you can email me directly, and you will always get a response. And everyone does. Now, people say to me, oh, Mark, is that sustainable? Can you continue to do that? And the answer is yes, it absolutely is, because it matters, and it's my role to be that personable, because I want my team members to be personable. I want them to be approachable. Everyone across the team should feel like they can talk to everyone in the team, because we keep patient care at the heart of it. And that is, for me, that's intentional leadership and being personable. Notwithstanding, the greatest thing is I actually enjoy it. I love being in touch with people. I love hearing from people. I love speaking to people. That is really, really important. Personal touch is critical in healthcare.
And how have you managed to align private equity investment, partnerships with private equity, with such a sort of purpose-led healthcare organisation? I think it's fascinating.
Yeah, absolutely fascinating. I'm on my third private equity partner with Icon now, and we've been very, very fortunate in who we've been able to partner with and work with, and they've all been really, really important at that particular moment in the Icon journey. What I would say around the choice of private equity partners is I'm always looking for someone who believes in the Icon mission and who believes in what we're doing, which means I'm looking for someone who is an experienced healthcare investor and understands healthcare and all of the things that we've been talking about, keeping the patient at the centre of everything we do. Private equity in healthcare has been really, really important. The reality is, if we had remained as a privately held company, we wouldn't be talking today about being in 6 countries and 60 cancer centres and all of the other things that we've done. That is a level of investment that is significant, so you can't do it without capital. And I think that's really, really important to note. Your private equity partners, I always approach those relationships the same as I do with my own team. It's about alignment. All right, what are we trying to achieve? We're trying to bring more care to more people, and we must be financially successful, because otherwise people aren't going to continue to invest in our mission. And if we're not financially successful, we can't continue to reach more people. So, the role of private equity in healthcare, I think, has been absolutely critical. I think we must also seek alignment with the private equity partner on what healthcare means. And if you put the patient at the centre of everything that you do, the other things fall into place. The other success comes from that. Look, I'm really fortunate. Our current private equity partner, EQT, deep European heritage, their values and their culture is not dissimilar to Icon. And at the start, we agreed, hey, let's sit down, let's spend the first 4 to 6 months of this relationship working on what our strategy is. And that's exactly what we did. And that's what we've been executing ever since. But that's about alignment. There's no ambiguity about what we're all trying to achieve together. Look, I'm also very fortunate in that it is my third private equity partner, which means, we have very open and frank discussions about what we're all trying to achieve. I think for first-time private equity CEOs, that can often be complex, but my advice to everyone is always be upfront, always be transparent, and if you have to deliver bad news, deliver bad news, and I think you will earn great respect by doing that.
Just take us inside the thought process when you guys are doing that, thinking about the growth strategy over the coming years. As we kind of outlined at the start of this conversation, the kind of scale of the challenge in terms of the number of people contracting cancer. There's a lot to be done. How do you make decisions on where to focus?
It's a great question. There is a lot to be done, and we can't do everything at once. And I think that does come down again to discipline and methodical decision making backed by data and facts and indeed experience. So there are still many places in Australia where access to cancer care is not where it should be. And we continue to fill that white space and deliver services where there is a lack of care. And we've continued to do that, and we've announced multiple cancer centres. We've just opened several new cancer centres, particularly in regional Australia. So I think there's that element. We've also, in the last 3 years, we've entered 3 new markets. So we entered Malaysia, after having been in Singapore for almost a decade. We've entered Malaysia. We have the first public-private partnership with the Indonesian government in Bali, at the Bali International Hospital, which is an incredible facility that I had the good fortune of visiting about a month ago. An incredible facility. So that's the first time that international oncologists from Singapore, Malaysia and Australia can work in Indonesia. So we're incredibly excited by that. And then most of all, We took an Australian business to the other side of the world, and we have opened in the United Kingdom, where we have our chemotherapy compounding facility in Corsham near Bath, and also our first cancer centre in Wimbledon, aptly named Icon Cancer Centre London. So we make those decisions based on an enormous analysis of those countries. And do they need someone like Icon, is the first question, or are they doing a great job by themselves? Do they need an approach of someone like Icon, where we provide integrated cancer care, where we're doing chemotherapy compounding, we're providing pharmacy, we're providing the delivery of chemotherapy and radiation therapy? So there's a lot of thought that goes into it. Now, it probably won't surprise you to know that I would get approaches from many, many countries all around the world wanting Icon to help. We can't do everything at once. We've got 3 new countries going on right now. What I'd say to other countries is we'll get there. We just can't do everything really well at the same time. So I think it's about being methodical. It's being about disciplined. Also sticking to what we do really well, which is oncology services.
And you've mentioned public-private partnerships, and in a number of markets, you guys achieving kind of the first of its type. You just mentioned the one in Indonesia there. What is it that makes these partnerships so effective in your mind? So
we come back to an earlier point I made around hospital providers are really good at providing hospital care, surgery, inpatient stays, all of the services that both public and private hospitals, certainly in Australia, do so well. We don't do any of that. We offer highly specialised services whereby we can partner with those hospital groups. And again, I'll come to radiation oncology as an example, because it was our first public-private partnership in Australia in Cairns in 2011. They are really capital-intensive businesses. So you've got a machine that is worth at least $4 million. You've got a maintenance contract on that machine, which is incredibly successful. You've got the infrastructure that goes around it. It has to be in a concrete bunker. And then you've got the costs of the staff. That is an enormous undertaking for a hospital to undertake if they're doing one of those centres. We now have more than 40 in Australia. So there are economies of scale of how we do that. Our buying power, our specialised staff, the fact that we have removed geographical borders of who can do what in what location, because it's a network. So I think there is an opportunity for hospitals to partner with specialised service providers like ourselves to deliver those things that are really, really difficult for hospital providers to do. Hospitals provide such an enormously varied group of services. I think it's almost impossible to be exceptional at every single one. So I think there's an opportunity to work with highly specialised providers like ourselves that can hopefully enhance a hospital campus. And that's certainly the approach that we've taken across Australia. And I think it's an approach and a partnership model that, and I must really make this point, David, it's underpinned by frameworks and KPIs and the private provider being held to account. And that's really, really important, and I don't have any problem whatsoever signing up to that. What we've achieved in Australia over the last 15 years is easily replicated in other markets, and I think we're seeing that now. We've got lots of discussions going on, and as you mentioned, we've got our first public-private partnership in Indonesia. So there's great opportunity here, and I'm a big believer that a healthy public healthcare sector requires a healthy private healthcare sector, and vice versa. They're symbiotic and they can work very, very well together.
And what advice would you give to execs or businesses who can see the potential for a public-private partnership? Maybe it's in healthcare, maybe it's not. How do you go about sort of building that relationship?
Well, I think the first thing you have to do is reach the right people, reach the decision makers who can make these decisions. And also the focus has to be on how can we make this better for patients? So if it's about reducing wait times for cancer patients, I think that's a narrative that everyone can stand behind. We want to do this. Yeah. How do we do it? So you've got to reach the decision makers. I'd also say to any executive who's trying to establish public-private partnerships in healthcare, be persistent. Be prepared to have the conversation. Be prepared to have the discussion. Don't be annoying, but be persistent. And also have your facts. Have the data. The first one is the hardest, because you need to then be able to display a track record. So I think that be really, really diligent on your data, be really, really diligent on what you commit to do, under promise and over deliver. Don't sign up for things that you can't deliver, because that is disastrous for everyone. I think there needs to be a lot of thought put into how these partnerships and these relationships work. I often say this: good neighbours require good fences, which means have really robust frameworks and KPIs and stand behind them, and deliver on what you say you will do. I think that the most important thing for any executive who is going down this path is to be known as a straight shooter, is to be known as being honest, and when you shake hands on something, that's what you deliver. That's what people remember. And again, we come back to this concept of old-fashioned values. They're really important. People respond to them. You do what you say you're going to do, and you just keep doing it.
Where do these values are clearly deeply embedded in you? Where do they come from?
I think they come from growing up in country Australia, where your word is your bond. Look, I'm a big believer. If I say I'm going to do something, I'm going to do it. And if I make a commitment to someone, I make that commitment. I don't commit something to someone that I can't deliver on. That is really, really important to me. And I would like to think that that's Icon's reputation as well. We deliver on what we say we're going to do. So, look, I think it comes from my upbringing. My mum and dad were simple people. We came from very humble beginnings. They even more so than me, in even more regional Victoria. They really did come from the bush, and they instilled in myself and my two brothers, I often say this, a set of values that are not negotiable. And I think you have to have those values and that framework in your life, because it guides everything you do. And I'd like to think that my wife and I are raising our children in the same way. These things really, really matter. And I think about it. You've done deals with someone or arrangements with someone and they haven't honoured that, I can guarantee you that's the only deal I will ever do with them. So yeah, we pick and stick. And I think that's also an important part of long-term relationships in healthcare.
Our closing tradition for the podcast is a couple of questions we ask. What's one thing you've changed your mind about recently, and why?
I had to buy my wife a new car. It was time to replace her car. So this has got nothing to do with healthcare, or maybe it does. We have bought our last 3 cars off the same guy, the same brand. I won't mention the brand. We decided to go and look at something else, something bright and shiny. We chased the bright and shiny object. The customer service was appalling. The product, although it looked nice, wasn't where we needed to be. We went back to the guy who has sold the last 3 cars to us, and his service was amazing. He couldn't do enough. We bought a car off him. There's something in that around, I talked about pick and stick, long-term relationships. We were seduced by a bright and shiny object that wasn't real. So we went back to the tried and true, and that relationship's really, really important. And my wife's now driving around in her 4th car from this particular gentleman and is very, very happy.
What's one belief that's never changed for you? Something you think more leaders should perhaps think about?
My commitment to all the things we've talked about, being an authentic leader, being open, being completely accessible to my people, that will never change, being personable. Just yesterday I saw one of our staff members had a great post on LinkedIn. So I commented on the post on LinkedIn, but I also sent them a text, and that really matters. And I think maybe she was a bit surprised that she got a text from me. It's really important because it really resonated with me, what she'd posted, and she'd done great work. People say, I haven't got the time to do that, or all that. Well, that's rubbish. You do have the time. So I think if I would say that one thing will never change, that is the time for my people and being completely approachable.
Mark, it's been an absolute pleasure getting to learn more about you, more about Icon. You do some very obviously important and serious work, but what shines through is so you maintain the sense of humour, the authenticity, and it's so inspiring to see what you and the team have done so far, and keep up the great work.
Thank you, David. And as I always say to our team, we're only just warming up. There's plenty more to do and so many more people to reach. So thank you so much for taking the time to speak with me.
Been a pleasure. Thank you, Mark. And there we have it. Mark Middleton, the CEO of Icon Group. What an inspiring conversation. So great to hear from such a purpose and authentic leader and such important work that they're doing around the world. If you enjoyed today's episode, please like, subscribe, or leave a comment. Even more importantly, if you know someone who could benefit from the wisdom that Mark shared with us today, please share the episode. I'm David Jepson. See you again next time for CEO Behind the Scenes.